Hi, everybody. I'm Dr. Carrie Lane, and I will be your course instructor along with Sue Fowler for this course. Our contact information is on the slide here. I'm the main course coordinator, and Sue's going to help with some of the course aspects and also assist with the Tiger Place outside of class activity. We're going to have a great class. I wanted to give you an introduction, just run through the syllabus and expectations of the class quick while the class gets started. We do get started pretty quick this semester, and we'll jump right into content in week 1 as well. So you can read the expanded description of the course. We're going to cover complex care management of older adults, and older adults are extremely complex and complicated patients because they have so many different comorbidities that interact and lots of physiological changes that also make it more difficult to manage. The objectives are listed here. We're going to work on everything from effective communication strategies and go all the way through and work on interventions. I do want to tell you that all of our interventions that we'll discuss and assessments and scales are evidence-based. They all come directly from the research. This is a very heavily evidence-based course. The textbook that is required for for this course is listed on the slide. It's Gerontological Nursing with the course point access code. You do need the online access for the course, and we'll utilize that using some of the vSims as we prepare for a couple of simulations. So you'll have weekly lectures online, and then you'll have some seminar days that are scheduled. The seminar days, for the most part, are self-scheduled, except for the very first seminar, which is next week. And next week's seminar is for all students to attend and is pretty important for information prior to attending the Tiger Place sessions. We'll have some homework, assignments, discussion questions, quizzes, and exams for this class. The grading scale is your standard grading scale for nursing. Also, we don't round. Late assignments get deducted 5% per day. And then you need a cumulative score of 73% on exams prior to adding in any other quizzes or assignments. Your assignments and what's on the grading scale is listed here. It's a little squished, but 100% is shown at the very bottom row there that you can't quite see. So you have some seminars that are worth 10% of your grade, quizzes, and the lowest quiz score gets dropped at the end of the term. That's worth 10% of your grade. You have several assignments. The assignments are hopefully interesting. We'll do a couple of assignments that are discussions related to a film that you'll watch. There's an assignment on medications and medications that are inappropriate for older adults. As an assignment about dementia patients and assisting with bathing when dementia is really severe and patients and residents don't want to participate in that activity. And then there's 2 math assignments, 2 exams and a final exam. And then 10% of your grade is 1 outside of class activity. That activity is actually at Tiger Place. You will work on communication, assessment, and teaching with older adults during that activity. You're expected to complete 1 of those, and you will self-schedule for that activity so that you won't have any issues with getting that done and scheduled. There's flexibility in that scheduling too. You can change your schedule all the way up to the very last day that we have an opportunity to be at Tiger Place. Once the last day hits, we're kind of stuck. So try to get signed up for that as soon as possible. You can review the attendance policy. It is this attendance policy that we use for all our classes, and it is in the BSN handbook. You can use the link below to access that. Exam absences also can be problematic for both faculty and students. So the exam absences do get tracked. We can do a makeup exam, but you may not be able to make up the exam based on your preferred scheduled time. And then there will be 5% deducted for any test that's not taken on the day it is scheduled. If you miss a seminar or an outside of class experience day, you need to make sure that first you report to myself for seminar days and Sue Fowler for Tiger Place. Make sure that you do that before you miss or immediately upon knowing that you need to miss. And then you may be asked for supportive documentation for those missed days. If you need to make up a seminar, you can do that with Leah Wood, and her email's included here. You can read over the academic dishonesty statement for the School of Nursing. We take academic dishonesty in the most highest regard, of course, and do want to make sure that everyone gets the same consideration and advantages. It's important to remember that you just shouldn't take any pictures on your OCA experience days. Don't worry about even taking your cell phone unless you absolutely have to, for example, for childcare responsibilities. But don't take any photos of the facility or the residents or the patients, and don't post any messages on social media at all. If you require accommodations, please let me know. I want to help you out with that, and we will make accommodations appropriate for your needs. There's a few other policies in the undergraduate handbook that you can review. Make sure that you do know these, as you are responsible for following all of them. All right, so that's the end of our orientation. Be sure to take a look at the week 1 content lecture. There's also a practice quiz if you want to take the practice quiz. And there is some pre-quizzes that will have information related to the readings for your week 2 assignment. Week 2 we have seminar 2, so that quiz will contain information for seminar 2 that you should get from your reading. Also, I'm in the process of updating the lectures. We're moving those to a different format, and some of the lectures refer to top hat or top hat questions. Please disregard those. I will be removing all of those as we progress, but right now they're not quite there. Well, thank you, and I'll see you next week.